Welcome. This is Jean Eaton of Information Managers, the practice management mentor. Today we have an interview with Kyle Sherritt of Sherritt Enterprises. It's my honor and pleasure to have you with us today and to have you and the audience joining us for our webinar event. That's great to have you here. You and I met first a number of years ago when you asked me for some help with your privacy impact assessment for Sherritt Enterprises. And that was the first time that we met. And since then, we have worked together with a number of different clients and your company providing the medical billing and the transcription services. So tell us, what is your story? How did you get into this business of medical billing specialist?
Well, essentially, Jean, first off, thank you so much for the positive introduction. It has been quite a while since we first met. That's crazy thinking back. Time really flies when you're having fun, I guess, hey?
Absolutely.
So getting into medical billing and transcription, actually, my mom started the company in 2009, 1997. Diane Sherritt started Sherritt Services, Sherritt Educational Services Incorporated. Now, she grew the company into a very successful small business, and in 2009, she started seeking a marketing director, somebody to take over new client development, client relationship, things like that. Basically, getting out there what we can provide to physicians in Alberta and, now Canada for that matter. So basically in 2009, I had a proven track record for sales. I was a very, very confident individual when it came to communicating. So I started learning the business in early 2009, and since then we have basically been able to provide the all-around best outsourced billing and transcription experience to physicians that we see possible. Now, it's as you know, it's really easy to sell a good product. So my job isn't that of selling. It's more of getting out there what it is we do and how it is that we do those things. So yes, in 2009, I started learning the business, learning the service that we performed, and adapting the mindset of a Sherritt Services contractor.
Yeah, and now you have how many clients or how many people working with you?
Working with me first off, Sherritt Services consists of about 25 individuals right now, transcriptionists, editors, medical billers, holiday relief specialists, the list goes on. So from a client perspective, we work with just under 300 physicians in Alberta. Canada, it's growing. Essentially, we're at just under 400 physicians working with us throughout Canada right now, and which on the grand scale is not that much at all. Now, that's what my job is trying to get out there the service that we provide and the fact that we're not actually trying to replace a job. We need whomever is in the office doing the billing to be our frontline communications expert. Essentially, when we start working with a new client, with a new clinic, we don't want to have to deal and contact directly with the physician unless we absolutely have to. So when we go into starting with a new client, we always tell them, listen, like, we are a billing expertise outsourcing company. We need somebody in-house to communicate with. Now, we are not saying that we're better than you at your current role. It's just that you're not only a biller when you're in-house, when we're speaking with these new people or new clients, you're also a receptionist. You're also an MOA. You're doing absolutely everything around the clinic. Sometimes you're even a clinic manager. So what we say is we're freeing up your tasks so that you can perform your job better. Let us take this, the onus of billing out of the clinic. You worry about being efficient within your clinic, everything else, and let us just worry about managing the physicians' incomes for them as best we can legitimately. So, yeah, that's, sorry, I started rambling, Gene.
You gave us lots of information. So you've got clients across Canada, predominantly at the moment in Alberta, but you're expanding into BC and other places.
Yeah, we just jumped into national billing essentially in September. We started working with BC Healthcare System, Nova Scotia's healthcare system, Ontario, basically familiarizing ourselves with the billing systems, billing rules and guidelines in all of the provinces in Canada. Now, in Alberta, we're very, very, very fortunate because of our the way that we pay our physicians or have our physicians paid. Everything is dependent on their time that they've spent managing, taking care of that patient until the midnight hour that you've seen that patient. You can get paid for everything that you have done to that patient, performing management of care. And in Alberta, and I believe, Nova Scotia and Alberta, the only two that are really, really capitalizing on that. And so the other provinces, when we come in to start learning their billings, it's almost like we're already functioning in an extreme atmosphere. So when we come in, there's just a little bit of familiarizing that has to take place in the other provinces. So we're on a kind of a learning curve right now, I guess you could say, Gene, for the rest of Canada, but definitely dialed down in Alberta.
Well, one of the nice things about that is once you've mastered one of the province's billing systems, it's very similar to the others.
Extremely.
Yeah. So those lessons learned can certainly be brought forward. Well, I'm really encouraged and I'm looking forward to getting into details with you.
Okay, yeah.
But one of the things I wanted to ask you is right off the top here, Kyle, is if somebody can't stay in and join us for the rest of the webinar today, if there's number one top tip that you would let your physicians and practice management clinic managers know, what would be your number one top tip about using a billing agent?
If you believe the professional is expensive, wait until you hire an amateur. Professionals, they are worth every single penny that you pay for them, because when you hire somebody, especially when it comes to monetary items such as a physician's income, which is not just a physician's personal income, it's a business income too, especially if it's a clinic. You've got 10 other employees depending on this income as well too. So yes, I would say professionals are worth every penny.
Absolutely. And that's really a great way to be able to phrase it. If you think that professionals are expensive, then wait until you hire an amateur. You can waste a lot of time and a lot of energy and a lot of frustration using somebody that doesn't really know what they're doing. This is Jean Eaton, the Practice Management Mentor.